This program contains vital information for you and your child. Now the moderator for today's program.
This is Luella Harris. I'm the founder of the National Awareness Campaign for Upper Cervical Care, and we are looking for people in pain. In fact, this is a nationally aired program that is telling you about a little-known procedure that has saved the lives of everyone sitting here in this studio. Parents, you need to be getting your children under this very, very rare special type of upper cervical chiropractic care. Well, they correct the atlas bone, which is just below the brain stem. I have with me today James Tomasi from Oklahoma City, who was a trigeminal neuralgia sufferer, and Pastor Looper, who was a perfectly healthy individual, he thought, and then he realized that he needed to get his atlas corrected, and now he's feeling better than he's ever done before. But gentlemen, we are all adults, but we really need to be talking about the importance of this care for children. Amen. And so parents, we are gearing this whole program to you. Gentlemen, it's interesting. I'm a 46-year-old post-polio fibromyalgia sufferer, or used to be. Had my parents known about this care when I was born.
That's right.
You see, what can happen to displace that top bone of the spine, the atlas, can happen in childbirth. I mean, the pressure that's on that head and neck going down the birth canal. And what's interesting, even in C-section, when the baby doesn't even go through that, we are finding children that had serious health problems, even as a result of the C-section. The next thing that happens is that, how do we learn to walk? By falling.
Yes.
You know, bang your heads against floors and walls and chairs and so forth. Coffee tables and off of bicycles and off of teeter-totters. And the frightening thing about this, parents, is that we pick our children up, we dust them off, we think they're perfectly fine, but what you and I don't know is the role the atlas plays in the health of the individual, no matter what age they are, but especially in the development of that child. And as recently as just the other day, now our radio programs are going out, our TV programs are going out, and one of the people that called in as a result of our program on one of the most recent radio programs, she had a very difficult pregnancy. And she's a small woman, and when her child was born, he was 10 pounds.
Good.
And he, I guess, just didn't have enough room to really develop in the womb. But she noticed as he developed that, in fact, he wasn't developing very well. And by the time he was 2 years old, he could not even walk very hard at all. He could not talk. And she had gotten under the upper cervical chiropractic care because she'd been in a car accident, and she found that her whiplash benefited so much from getting under this care. So she thought, well, what about Johnny? So she got Johnny under care, got the top bone of his neck precision corrected with the pre-X-rays, the meticulous analysis of those X-rays, the correction, just a light massage, a light tap, or a quick wrist thrust there at the side of the neck. And she had that done for Johnny. And I think she said within about a month, she noticed that he was beginning to walk again. And then she noticed that his speech patterns developed. He was 3 years old before she heard about upper cervical chiropractic care. Now, what do you think would have happened to that little baby had he been under care from day one?
Oh, boy.
You see, so we have so many stories that we can tell, but we're hearing about children when they get under care.
Well, as one of the things in your service, as we go out to have those patient appreciation nights in these clinics, to get the awareness out so that more and more people. We were at a doctor's office just a few nights ago, and a man and his wife were there. No, the wife and child weren't there. And he started telling us about his child. And as he started talking, he started crying. He was really emotionally worked up about this. He said that the baby was about to be born, the hand was stuck on the side of the face, and it would not come out through the birthing canal. 31 hours later, with a lot of pushing and they gave her some type of a medicine too to get the contractions to really
induce the labor even more.
To induce it even more. Out came the baby, but he could tell, he said almost instantly that the baby was not right. Didn't seem
right. Didn't they pull on the head and kind of twist the head, trying to get it out?
Just trying to get it, just a normal thing, and I believe they were even using forceps, he said, doing their best to get that baby to get out of there so that it would work. Well, what they noticed immediately is that the baby's bowel movements did not move. He could not, or she could not, hold any type of liquid down. So they began to feed her through her stomach. If she was to have a bowel movement, they had to put a suppository in, and that would only work one time and nothing. And he says,
how was she sleeping?
horrible, would not sleep. Sleep off for 20 minutes and then back up awake. And it was virtually beginning to kill the well, I mean, it's their baby.
Yes, exactly.
They want that baby to be right, but it wasn't. But now both of these two are under care of upper cervical. Never dawned on them that a child this age could have some type of relief. The first correction, they said as soon as the correction was in place, the baby burped first time, had a bowel movement, and fell asleep.
Oh, my goodness.
And I said, well, where's the baby? I want to meet her. And they says, my wife and her up in Branson, Missouri.
Having fun.
Having fun.
Hallelujah.
And I says, how long ago was this? And he said, 3 years ago. But he said, chances are, had we not known of this wondrous service, she wouldn't even be walking or any type. He said,
We'll be back to our program in just a moment. To get in touch with the National Awareness Campaign for Upper Cervical Care in your area, call 1-866-248-7030. Dr. Bill Trevens, an upper cervical doctor, can give you a personal call, answer any questions you may have, and also send you additional information. That number again is 1-866-248-7030. That's a toll-free number. And now, back to our program. We now join Luella speaking with parents just like you about their children and their experience.
Hello?
Colleen,
Yes.
this is Luella Harris from Florida.
Hi, how are you?
I'm doing great. We have been talking with some tremendous people by phone today, and tell me your story.
My son Dylan, he's now 10, and after I was getting well and seeing results with my migraines, I started bringing my children in after listening to how well it would help my son. Because I would say how my son is being diagnosed with ADD, and they want to put him on Ritalin, and he was only 4.5. Mm-hmm. And we brought my son into a family plan, and he started getting service, and it was amazing. The doctors wanted to put tubes in his ears because he had speech impairment, diagnosed with ADD, and he had to have reading glasses. And I think, if I'm not mistaken, Dylan's first adjustment, when he was only 4.5, he actually got up and says, "Mom, I can hear."
Oh, my
His
gosh.
ears just drained, and he could hear Mommy clear for the first time.
Oh, my gosh.
I could cry now just remembering. And he's now 10.
Well, you know, Colleen, we hear a lot in our organization by moms and dads who get their children under care, particularly children that have had tubes put in their ears or are about to have tubes put in the child's ear, and they hear about this type of care. They get the child having their atlas corrected, and the ears drain. The immune system is boosted, because I'm sure you know from experience that when the atlas is out of position, the immune system, is lowered. So I am so glad you brought that up, because it's our plea to get this information out to parents before they put tubes in the ear, before they give them Motrin and all the things that we're dumping down the children's throat. Get their body balanced and get the interference removed at the brainstem area and see what the body will do.
Exactly, because I went on the internet about children who have tubes put in their ears, and 90% of them, they all came out anyhow, and then have to be reinserted, and you grow out of earaches. I mean, I read everything, and for me, I didn't have to do that, because Dylan's first adjustment drained his ears, and to me, it was like a miracle. And then it worked on his attention deficit disorder, where he's able to focus a little more, and we put him in karate to help him.
Excellent.
And he has a upper trunk disorder where he was very heavy from the waist up, and slowly he could hold his upper trunk normally and sit Indian style and play checkers instead of laying down on his side playing checkers. I mean, there's huge improvements in my son.
Excellent.
And my daughter, she was 18 months old. I remember her in her snowsuit and her diaper having her first adjustment.
Yes.
Just because she wasn't sick.
Right.
But because I didn't want her to have to take any medication.
And
she's never had antibiotics or amoxicillin. She's now 7.
Colleen, I could just give you a medal right now. Well, that's the whole point of getting parents to understand. So many parents get under care and they don't even think about their children. But if you and I could get our children under this care early on, if you and I had been under this care early on, so much could have been avoided. And we want to say to parents right now, get your child's brainstem area evaluated now by upper cervical care, because it can help avoid problems down the road that simply don't need to happen to your child.
It's terrific. My son had a temperature one time, 105.7, and I did not panic because I learned how to not panic. I had a book I would read. I would not panic. Dylan would get an adjustment, and within 8 hours, his temperature was like right down to 101.
Of course.
If I had given him amoxicillin, he would have been probably low-grade temperature for a week.
Exactly.
So he actually healed a lot faster.
Colleen, that's the message we want to convey to all the parents in America. Thank you so much for telling your story.
Thank you.
You're welcome. You take care.
I will.
And while I'm thinking about it, gentlemen, I want to remind people that if you would like for an upper cervical doctor to call you personally, let us know that, and we will arrange it. But one of the women that I've spoken with, her grandbaby had a very difficult birth, and the baby came out blue. And the baby also had trouble with the bowel movements. And in fact, his skin after a while began to turn a little yellow, constantly crying, not sleeping. And they went in and got his little atlas corrected. And parents, this procedure is very underwhelming to both children and adults. It's very gentle. My little 6-year-old gets up on that table herself, and she looks forward to it because there's nothing there that she can really fear. And so the child, the mom was actually an RN, had heard about upper cervical chiropractic, took the baby in, and in that first correction, within moments of that atlas being corrected, the baby began to turn pink. And that baby also began to have the regular bowel movements. That child is now 6 to 10 years old. I'm not quite sure where. And that little boy asked, Mommy, I need my atlas is out. I need to go in and get adjusted.
Wow. Wonderful.
And we were talking earlier before the program started about bedwetting. And I can tell you that there's tremendous help with this, with bedwetting. There was another woman. In fact, let me say this to you. This is something I've never said before on the air. With me being post-polio, twisted spine, I wet the bed for years, and the humiliation of that was intense, even up into junior high school. No. And you see, post-polio syndrome, fibromyalgia, my parents had no understanding, no information all about this care when we were in Kenya, East Africa, and I contracted polio. My atlas obviously was out of his position. The thing that pushes us as an organization, the National Awareness Campaign for Upper Cervical Care, to get this information out to parents is that there are children right now with conditions that are developing that if their parents knew about it in time, we could avoid it entirely. Moms and dads, what you may not be aware of is that when the atlas is out of position, the immune system drops. Therefore, when you are thinking about putting tubes in the ears because your child can't get past these ear infections or colds and flu or whatever, please get under care. And so many times the bedwetting can stop, the ear infections can go away, the immune system is boosted. And if I had known about this, or my parents had earlier on, there's a possibility that I would not have even contracted polio. Now, what is the cost for that? You know what's amazing? Those of you that have had so many different problems with your children and yourselves and your friends, you're going to pay a fraction of the cost, because just for a few $100s, because the x-rays, you've got to have some x-rays. But then after that, it's no more than the regular chiropractic care. So I know the doctors that we work with people on a payment plan. So please do not let finances stop you.
We'll be back to our program in just a moment. To get in touch with the National Awareness Campaign for Upper Cervical Care in your area, call 1-866-248-7030. Dr. Bill Trevens, an upper cervical doctor, can give you a personal call, answer any questions you may have, and also send you additional information. That number again is 1-866-248-7030. That's a toll-free number. And now, back to our program. Once again, let's join Luella with another call.
Hello?
Barbara?
Yes.
This is Luella from Florida.
Oh, Luella.
How are you?
Very good. I'm so happy that I have the opportunity to talk to you.
Well, talk to me. Tell me your story.
I don't know if you've ever heard about this condition, but there's a condition called NLD. It's a nonverbal learning disability. And my daughter was diagnosed with that. I have all the paperwork from a hospital in my area. And she was having so many problems in school that she actually had a teacher's aide that would go from class to class with her. And I worried so much about her that I had trouble sleeping at night. And I started to notice behavior changes in her. And, you know, things changed in her little by little, but gradually. But there were things that weren't supposed to change.
Mm-hmm.
And
well, I think Barbara, I think the point that you're making here is that an adult is diagnosed with something, all right? And that with that diagnosis comes the death sentence, you know, that this is the way it's going to be. Nothing can alter this. This is the way your future is going to be. And the tragedy of that, Barbara, as you well know, is that people then start to believe that. And well-meaning doctors in all professions make the mistake of thinking because something is beyond their level of expertise, then nothing can be done, okay? And that's the lie that we keep coming back and attacking throughout this program, that things can be done. When you give the body what it needs, you balance the body, you remove the interference to the organs and the tissues, and the body can heal itself the way it was designed to.
My son, at soccer practice one day, the parent that was supposed to pick them up that day never showed up. So they were left there for about a half an hour alone on the field, and they knocked the soccer ball out in the street. And my son ran out after it, and he was hit by a car. Mm. So he had some problems before that accident, but they got much worse after the accident. And, well, one of them was his speech problem, which, you know, he was seeing a therapist for the longest time. And that was the first difference with him. His speech therapy didn't help him. It didn't help his speech problem. And kids would come up to him at school and ask him to say different words, and it was very embarrassing for him. And he started to go to Dr. Trevens, and we were just going there for the digestion problems. We weren't really going for the other problems. But after the first adjustment, he was pronouncing words that he could never pronounce.
You know, Barbara, I have to tell you that another mother contacted us, and they got their child under care that was diagnosed, not with some of the things you've talked about, but with ADD. And she was about 6 years old, and after her first correction, they took her home, and she looked around the house, and she said, "Did you all get new wallpaper?" In other words, the body started coming alive with this care, all right? And the little child literally was
becoming aware of her world.
You know, it's like she became aware of the print on the walls and the colors, and, you know, waking her little body up and her mind up. And
my word.
You know, I really want to say thank you so much for taking the time to be there and tell your story today.
Thank you. Honestly, from the bottom of my heart, thank you.
You are so welcome. Take care.
Bye-bye.
Bye-bye.
We'll be back to our program in just a moment. To get in touch with the National Awareness Campaign for Upper Cervical Care in your area, call 1-866-248-7030. Dr. Bill Trevens, an upper cervical doctor, can give you a personal call, answer any questions you may have, and also send you additional information. That number again is 1-866-248-7030. That's a toll-free number. And now, back to our program.
Ladies and gentlemen, my parents would have given an arm and a leg and everything they owned had they known to do for me what James and Richard and I and the rest are able to do for our children now.
That's right.
We got Shannon under care at 1 month of age. And she has now grown up. Her little spine is as straight as it can be. And you know what,
Healthy.
Pastor Looper, you talked about getting this information to the schools so that at age 6, people are being tested for the Atlas correction so that scoliosis can be stopped, so the immune system can be boosted. In fact, it is the desire of our hearts for this information to be in every children's, we call it toy
stores,
or bedding store, or
baby
clothing store.
stores,
That's right. It is the desire of our heart that the public school system
nurseries?
Yes, the nurseries, the daycare centers.
Yes.
There needs to be an upper cervical doctor available at, and this is going to beyond another thing, but at every emergency room. Of course, that may take a while to do, but we really, really need the public school system to sit up and take a note, because one other thing that we're finding can respond to this type of care is attention deficit disorders and ADHD.
And there's just about time for one more phone call, so let's take it right now.
Yes.
Polly, this is Luella Harris from Florida.
Hi.
How are you?
I'm doing very well, thank you.
I want to hear your story. We're on the air. We're all ears.
Oh, wonderful.
What has happened to you?
I had a multitude of physical problems all my adult life, and I started listening to your story. And for some reason, everything was just coming together, everything you were saying. I recognized a lot of the, health history problems that I had. Mm-hmm. And also, when I heard that, people who are misaligned often have one shoulder higher than the other and one leg shorter than the other, I said, that's me. Yes. So I ran to the phone. Well, after I had such success with this, which was really just a literal miracle for me, I knew that I had to get both of my daughters in. My oldest daughter, who is 24 years old, she's a dental assistant working in a neighboring community, and she just had a lot of problems all through high school, thyroid problems, and she just seemed to be sick all the time. And by the time she got to be a young adult, she was having really severe problems with her monthly cycles. Mm-hmm. Every month, she would have such terrible pain that she was incapacitated. She couldn't go to work. She had severe headaches. She'd be vomiting, fainting, and she just seemed to be so locked up, both spiritually and emotionally. It was just so painful for me to see that. Mm-hmm. We also believed that she had attention deficit hyperactivity disorder as a child, ADHD, which was never diagnosed. But one of her college professors, who was a psychologist, said he believed she was a classic case. Mm-hmm. So she had a lot going on, bless her heart. And I would say within 3 months, she was just getting completely turned around. Now she's doing so well, and she's happier. She's just like the child I knew when she was about 8 years old.
That is fantastic.
And that's been a thrill for me. And then her sister, who is 14 years old, was really struggling with all kinds of problems like insomnia, recurrent viral infections, whooping cough. And we thought she had attention deficit disorder, not with the hyperactivity, but the ADD, because even though her grades were really heading for the basement, what can I say? Mm-hmm. And she was very scattered in her thinking. She was disorganized. She was having trouble concentrating. And I knew that she had a bright, creative mind because I had homeschooled her for 2 years when she was very young. I knew something was really wrong. And the strange thing was, everybody was saying, well, get her tested for ADD, get her tested. And I'm thinking, this is crazy. There has been no history of learning disabilities on either side of our family. If anything, everyone has been high achievers. What's going on? And it's so painful for parents when they see their kids are hurting and struggling like this, and you just feel so helpless.
Exactly.
But she came in, and boy, I'll tell you, this year has just been phenomenal for her. She's gotten almost straight A's. She has no insomnia. She's had maybe 1 or 2 just light colds, and she's also just happier. Her whole demeanor is just lighter and happier, more optimistic.
Polly,
That's right.
We're going to have to run, but we're going to take your story, and we're going to share it with everybody that will listen. And thank you so much for being there and calling in.
Well, I'm so glad it could be helpful. And thank you, Luella, for everything that you're doing.
You are so welcome.
We'll be back to our program in just a moment. To get in touch with the National Awareness Campaign for Upper Cervical Care in your area, call 1-866-248-7030. Dr. Bill Trevens, an upper cervical doctor, can give you a personal call, answer any questions you may have, and also send you additional information. That number again is 1-866-248-7030. That's a toll-free number. And now, back to our program.
Parents, one of the best things you can do, you're having the children's teeth checked, you're having their heart checked, you're having their eyes checked, but the one organ in the body that controls every other organ is the brainstem. And when the atlas is out of position, it cannot function. Amen. Again, call our toll-free number, and we plead with you to get your children under care.
We'll give that number out again one more time, but before we do, here's a personal message for you parents from Luella.
You know, I was just sitting here listening to all these people, and do you all realize that if I had not had to deal with chronic condition like this for years, that there are people right there, out there, that we've talked with tonight whose lives have been changed, that would, God knows where they would be today. And so if I can get through this, you know what I want to say to people out there that we are trying to reach. I don't know you by name, but I do know pain. At least I know my brand of it. And one of the most difficult things that happens when you live with a chronic condition is it is so hard to keep up your courage. It is so hard to believe that something really can be done and there is hope. And there were only two things that I wanted to accomplish with this program today for you. And the first thing was to offer you hope again and to challenge you to believe again and get out there and try one more time. And not just one more time, but healing is a process, like one of our people said. And it takes energy, it takes discipline, it takes sometimes being willing to climb up the side of a cliff with your fingernails and your toenails. But I wanted to give you hope, and then I wanted to give you a definitive piece of help with information that you can follow up and get involved with. This is so much more than a pill. This is so much more than a quick fix. This is literally something that is so huge that it puts your body in the position that it can begin to repair itself, and that is what you want. So my hope for you and my prayer for you is that if you are in the middle of a dark tunnel, as you listen to this program today, that this program will be for you the light at the end of the tunnel. And if you will start grasping and start moving toward that light, see, when you lose hope, you stop taking action. And that is the worst possible decision that you can make. Now, for you that are in a crisis situation, I am challenging you to do what I did and call the number and explore this. And I'm not saying to you this is going to fix everything. I'm saying to you that this is the very basis for the beginning of getting well. For those of you that are listening to this that are already into wellness and you want to get better, this is going to enhance everything that you're doing for your bodies. So, Dave, I want to give that number one last time, and my heart is with you, and I challenge you to hope again and get under upper cervical care.
When you call the National Awareness Campaign for Upper Cervical Care, we will have an upper cervical doctor in your area give you a call to answer any questions you may have and send you more information. The number is 1-866-248-7030. That's 1-866-248-7030.
Thank you for listening.